As we age, maintaining a healthy diet becomes increasingly important to support overall well-being and manage chronic health conditions such as heart disease, diabetes, and digestive disorders. Fruits are often considered a cornerstone of a balanced diet because they provide essential vitamins, minerals, and antioxidants. However, not all fruits are equally beneficial for seniors, and some can pose significant health risks. Factors like high sugar content, acidity, or potential interactions with medications can make certain fruits problematic for older adults. While these risks might not be a concern for the general population, seniors often face unique dietary challenges, including slower metabolism, changes in digestion, and medication dependencies. Eating the wrong kinds of fruits can lead to spikes in blood sugar, exacerbate digestive issues like acid reflux, or even interfere with prescription medications. In this video, we will highlight 8 fruits that seniors should be cautious about or avoid altogether due to these potential health risks. By being informed about these particular fruits, seniors and their caregivers can make better dietary choices that promote health and longevity. As always, it is recommended to consult with a healthcare provider before making any major changes to one's diet, especially when managing chronic conditions. Before we continue, if you're enjoying this content, please take a moment to like, comment, and share it with your friends. Doing so helps more people discover the channel. Now, let's dive into the 8 fruits seniors should never eat. Pineapples are another tropical fruit that, while delicious and rich in vitamins, can cause significant problems for seniors, particularly those with digestive issues. Pineapple is highly acidic, and this acidity can exacerbate conditions like acid reflux, GERD, gastroesophageal reflux disease, and heartburn, all of which are more common in older adults. The high acidity of pineapple can irritate the lining of the esophagus and stomach, leading to discomfort and worsening symptoms in those who already suffer from digestive problems. Beyond its acidity, pineapple contains an enzyme called bromelain, which can further complicate digestive health. Bromelain is known for its anti-inflammatory properties, but it can also cause digestive upset, especially in seniors with sensitive stomachs or pre-existing digestive conditions. Consuming too much pineapple can lead to nausea, diarrhea, and even vomiting in some individuals. For seniors who are already prone to digestive issues, the potential for such adverse reactions makes pineapple a fruit to avoid or consume only in small amounts. Pineapple also poses risks to dental health, another concern for seniors. The high acidity of the fruit can erode tooth enamel, increasing the risk of tooth decay and sensitivity. Seniors who may already experience dental problems due to aging should be particularly cautious with acidic fruits like pineapple. Eroded enamel can lead to cavities, gum disease, and other dental issues that can be painful and expensive to treat. Rinsing the mouth with water after consuming pineapple can help mitigate some of these effects, but for many seniors, it may be best to limit or avoid this fruit altogether. Bananas are a staple fruit for many people, including seniors, due to their convenience and their reputation as a healthy potassium-rich food. However, for certain seniors, particularly those with kidney disease or those taking specific medications, bananas can be problematic. Bananas are high in potassium, which is essential for maintaining healthy blood pressure and heart function. But for individuals with compromised kidney function, too much potassium can be dangerous. The kidneys are responsible for filtering excess potassium from the blood, and when they are not functioning properly, potassium levels can build up, leading to a condition called hyperkalemia. Hyperkalemia is a serious condition that can cause muscle weakness, fatigue, and in extreme cases, irregular heart rhythms or even heart failure. Seniors who are on medications such as ACE inhibitors or potassium-sparing diuretics, which are commonly prescribed for managing blood pressure and heart conditions, are particularly at risk. These medications can increase potassium levels in the body, and consuming potassium-rich foods like bananas can exacerbate this effect, leading to dangerously high levels of potassium in the blood. In addition to the risks associated with potassium, overripe bananas can also contribute to constipation. While bananas are often considered a source of fiber, their fiber content decreases as they ripen and they become more starchy. For seniors who are already dealing with digestive issues or slowed digestion due to age, consuming overripe bananas can slow down bowel movements, leading to constipation. This can be particularly uncomfortable for seniors, as constipation is a common issue in older adults due to a variety of factors, including medication use and reduced physical activity. Dried fruits, such as raisins, apricots, and dates, are often marketed as healthy snacks due to their portability and concentration of nutrients. However, for seniors, dried fruits can present several challenges. One of the primary concerns is their high sugar content. When fruits are dried, the water is removed, leaving behind a concentrated source of sugar. This means that a small serving of dried fruit can contain the same amount of sugar as several servings of fresh fruit. For seniors with diabetes or those at risk of developing insulin resistance, consuming dried fruits can cause rapid spikes in blood sugar levels, making it difficult to manage glucose levels. In addition to their high sugar content, dried fruits can also cause digestive issues. While they are a good source of fiber, the concentrated fiber in dried fruits can lead to bloating, gas, and discomfort, especially for seniors with sensitive digestive systems. Eating too many dried fruits at once can overwhelm the digestive system, leading to issues like diarrhea or cramping. For seniors who already struggle with digestive health, such as those with irritable bowel syndrome, IBS, or diverticulitis, the dense nature of dried fruits can exacerbate symptoms and lead to flare-ups. Another consideration is the preservatives often used in commercial dried fruits. Sulfites are commonly added to dried fruits to preserve their color and extend their shelf life. While sulfites are generally considered safe for most people, they can cause allergic reactions or asthma symptoms in individuals who are sensitive to them. Seniors who have asthma or other respiratory issues should be particularly cautious about consuming dried fruits that contain sulfites, as they could trigger respiratory problems. Mangoes are a tropical fruit loved for their sweetness and juicy texture. They are rich in vitamins A and C, as well as antioxidants, but for seniors, mangoes can present some significant drawbacks. One of the primary concerns with mangoes is their high glycemic index, GI. Foods with a high GI cause blood sugar to rise quickly, which can be particularly harmful for seniors with diabetes or prediabetes. Mangoes, despite their nutritious profile, can cause rapid blood sugar spikes due to their high natural sugar content, leading to difficulty in maintaining stable glucose levels. For seniors managing their blood sugar, consuming high GI fruits like mangoes can make it harder to control blood sugar swings. This not only increases the risk of complications from diabetes, such as neuropathy or vision problems, but it can also lead to feelings of fatigue, irritability, and confusion due to sudden drops or rises in blood glucose. Seniors who enjoy mangoes should do so in small quantities and perhaps combine them with foods that have a lower GI to help balance out the effects on blood sugar. In addition to its glycemic impact, mangoes are also relatively calorie-dense compared to other fruits. While they provide a wealth of nutrients, they can contribute to unwanted weight gain if consumed in excess, particularly for seniors with reduced activity levels. As metabolism slows with age, maintaining a healthy weight becomes more challenging, and calorie-dense foods like mangoes can make this even harder. Seniors trying to manage their weight should be cautious with portion sizes, ensuring they enjoy mangoes as an occasional treat rather than a daily indulgence. Figs are often praised for their high fiber content and rich flavor, making them a popular choice for people looking to boost their digestive health. However, for seniors, the fiber content in figs can actually pose a risk, especially when consumed in large amounts. While fiber is essential for maintaining a healthy digestive system, too much fiber can cause digestive distress, particularly in seniors who already have slower digestive systems due to aging. Eating too many figs can lead to bloating, constipation, or even intestinal blockage in some cases. For seniors who have conditions like irritable bowel syndrome, IBS, or diverticulitis, the fiber in figs can trigger or worsen symptoms, leading to discomfort or even flare-ups of their condition. Additionally, figs have a natural laxative effect, which can cause diarrhea or dehydration in seniors if they consume too many at once. Dehydration is a particularly concerning issue for older adults, as it can exacerbate existing health problems like kidney disease or lead to serious complications such as urinary tract infections or confusion. Another potential risk of figs is their high sugar content. While figs are packed with fiber, they are also naturally high in sugar, which can cause blood sugar spikes in seniors with diabetes or those who are insulin resistant. This makes them a risky fruit for those trying to manage their blood glucose levels. For seniors who enjoy figs, it's best to consume them in moderation, particularly in their fresh form rather than dried, to avoid the concentrated sugars and excess fiber that can lead to health issues. Lychees are a sweet and exotic fruit that many people enjoy for their unique flavor. They are often found in tropical regions and are rich in vitamin C and antioxidants. But for seniors, lychees can present specific risks. One of the most concerning issues with lychees is their potential to cause unstable blood sugar levels. Some studies have shown that consuming large amounts of lychees, especially on an empty stomach, can cause hypoglycemia, dangerously low blood sugar levels, particularly in individuals with pre-existing blood sugar regulation problems. For seniors, especially those with diabetes or those on medication to lower blood sugar, this effect can be dangerous. The phenomenon of hypoglycemia linked to lychees has been particularly noted in instances where large quantities are consumed, and while rare, it highlights the importance of moderation, especially for seniors. For those managing diabetes, a sudden drop in blood sugar can lead to dizziness, confusion, and fainting, which are dangerous for older adults and could increase the risk of falls or other accidents. Seniors who enjoy lychees should ensure they eat them as part of a balanced meal rather than on an empty stomach, and they should be cautious about eating them in large amounts. Another concern with lychees is the potential for allergic reactions. While most people can enjoy lychees without any issues, some individuals, particularly those with a history of fruit allergies, may experience reactions ranging from mild symptoms like itching and rashes to more severe issues like difficulty breathing. Seniors with sensitive immune systems or a history of allergies should approach lychees with caution and be mindful of any unusual symptoms after consumption. Pomegranates are often celebrated for their high antioxidant content, particularly their polyphenols, which are believed to support heart health and reduce inflammation. While pomegranates do offer numerous health benefits, they also come with certain risks that seniors should be aware of. One of the most significant concerns is the interaction between pomegranates and certain medications, particularly blood thinners such as warfarin. Pomegranates may interfere with the metabolism of these medications, increasing the risk of excessive bleeding or bruising. Seniors who are on anticoagulant therapy to prevent blood clots must be particularly cautious with pomegranates, as consuming the fruit or its juice can lead to dangerous side effects by amplifying the effects of the medication. Additionally, pomegranates may also interact with medications for high blood pressure and cholesterol, making it important for seniors to consult with their healthcare provider before adding pomegranate to their diet regularly. Another issue with pomegranates is the difficulty some seniors may have in consuming them. Pomegranate seeds, while nutritious, are small and can be difficult to chew, especially for seniors with dental issues or those wearing dentures. The hard seeds can pose a choking hazard or cause discomfort for those with sensitive teeth or gums. Additionally, the fibrous nature of pomegranate seeds can be hard on the digestive system, leading to constipation or irritation, particularly in seniors with pre-existing digestive conditions. Cherries are a sweet and tart fruit that many people enjoy, particularly during the summer months. However, cherries can be problematic for seniors due to their high sugar content and their potential diuretic effect. Cherries contain natural sugars, and while they are a source of valuable nutrients like vitamin C and antioxidants, the sugar in cherries can cause issues for seniors with diabetes or those who are at risk of developing the condition. Eating too many cherries can lead to spikes in blood glucose levels, making it harder for seniors to manage their blood sugar. Another issue with cherries is their diuretic properties. Cherries have a natural diuretic effect, meaning they can increase urine production and lead to more frequent trips to the bathroom. For seniors who are already taking diuretic medications for conditions like heart failure or high blood pressure, consuming cherries can exacerbate this effect, leading to dehydration. Dehydration is a common concern among older adults, as the body's ability to retain water decreases with age. Dehydration can cause a range of problems, including dizziness, confusion, and even urinary tract infections, which are more common in seniors. Seniors who enjoy cherries should be mindful of portion sizes and monitor their fluid intake to avoid dehydration. While cherries can provide health benefits, such as reducing inflammation and supporting heart health, the risks associated with their sugar content and diuretic effect make them a fruit to be cautious about, particularly for those managing diabetes or already on medications with diuretic effects. Maintaining a healthy diet is essential for seniors to manage chronic health conditions, sustain energy levels, and support overall well-being. While fruits are a vital part of a nutritious diet, not all fruits are suitable for older adults due to potential risks. The high acidity of pineapples, the potassium content in bananas, and the concentrated sugars in dried fruits all highlight the need for careful consideration when selecting fruits. Mangoes, figs, lychees, and pomegranates, although often celebrated for their nutritional value, can also pose unique risks to seniors, such as blood sugar spikes, digestive issues, and medication interference. It is important for seniors and their caregivers to be aware of these risks and make informed decisions about fruit consumption. Consulting with healthcare providers is crucial, as each individual's health needs and medication regimens differ. By understanding which fruits to avoid or consume in moderation, seniors can continue to enjoy a healthy, balanced diet that supports their overall health without risking adverse effects.